Tammy, what strategies are you aware of that DSPs can use to help reduce transmission of COVID-19 when they are supporting people with disabilities or with people who are aging who are living together in those congregate settings?
Sure. So I have several things that I would recommend. The first one's, again, is leading by example. So the people you serve are going to look to you to see what are you doing? Are you making sure you're performing hand hygiene and wearing a mask? So lead by example. The other thing I would say is provide education to those that you work with and to give frequent reminders. So if we give somebody education, say, a month or two ago, today they might forget. So they might need those gentle reminders to use alcohol-based hand rub or to cover their cough or, to do certain things of that nature. So make sure you're supporting the people that you serve as well with their healthy decisions. And so empower them to make good choices, provide those reminders, and to also give praise or compliments when you see them doing something right. So if you see them performing hand hygiene at certain time periods, praise them for that. And as I said, give those gentle reminders to help support them in making those healthy decisions. One thing we didn't really cover is if the people that the persons that a DSP is working with, if they have sensory, cognitive, or behavioral issues where they can't, for example, wear a mask, think about other interventions that you can implement to also reduce the risk. So can you then make sure you encourage vaccination if they're not vaccinated, staying 6 feet apart from others if you're out in a public setting, or going out into public settings when they're going to be less busy. So for example, if you need to go to the grocery store, do so at a less busy time in the day. If they're not able to wear a mask or maybe be able to comply with that. So one of the key pieces here that can be really difficult is we know what we should do. We just have to find those creative ways to do it. And so, for example, if we're talking about hand hygiene, carry alcohol-based hand rub with you, at wherever you're at. So each setting is going to be so varied, and then structure that, So for example, anytime you leave the setting where they reside, maybe have them performing hand hygiene. And then again, upon return, or at certain points in the day, when you sit down, before you sit down to have a meal, make sure that they're performing hand hygiene. Or if they're sitting down in a common area and they're going to use, say, a remote, or if they're entering certain areas in the setting, see if you can get that as part of your normal routine as to when to perform hand hygiene. And that'll help not just with COVID, but with all types of infections. So really incorporate it in your day-to-day activity. Also have supplies easily accessible. And then I would also recommend making sure that you clean and disinfect the environment frequently. We haven't talked about that as much, but make sure you're cleaning surfaces in the bathroom, in dining areas, or in common areas more frequently, especially when you have multiple individuals living together. And then also think about equipment that they're using, walkers or canes or wheelchairs or any other adaptive devices. Put that into a cleaning schedule rotation. And, DSPs can help with cleaning and disinfecting, but you could also educate the people you serve if it's appropriate, to help with that cleaning and disinfection process, to really be looking at the environment as well as equipment. Once again, just really monitoring for signs and symptoms of illness. COVID can be quite tricky in regards to the signs and symptoms that you might be seeing. So be sure to review those signs and symptoms. The CDC has a great list, and just be really mindful of if the people that you serve are developing new signs or symptoms, that you then contact the provider so you can get testing if needed. And the same with staff. Be very alert for any changes in signs or symptoms or how you're feeling prior to showing up for work. So, I think really the key concept here is taking those infection prevention and control concepts that we know we should be doing and figuring out how we can really make that happen. Infection control really is a bundled approach. It's not just one thing. It's multiple things working together to prevent infection. So it's hand hygiene, it's mask, it's vaccination, it's making sure our environment and our surfaces are cleaned, it's social distancing. It's all of those things that we've been talking about throughout our conversation today.
Thank you so much. I've learned so many things through this information and the practical tips that you've given people in how to help reduce the risk of COVID and spreading it. It's been really, really great.